Hey there, guys. Between Two Teeth, we usually don't talk about teeth, but today you're in for a special treat. We're talking about teeth, we're talking about oral maxillofacial surgery and periodontics with our good friend from the podcast Everyday Oral Surgery, Dr. Grant Stuckey. Please give a listen. But I'm working on it.
And also to pick, you are working on it, and you're the
You
man.
are working on it. I love it.
Oh no, I was just gonna say to piggyback off your other very initial comment that Steph made about not speaking poorly about colleagues. I mean, I would piggyback on that and say that I have never grown a practice at all by saying any bad things about anybody, and it's the total reverse. Like it always grows more when I say, I'm sure that this was a complicated scenario. This Dr. Jones who does these, implants is so experienced, and so I know if it went bad in his hands and there was difficulty, it probably would have been the same in my hands. I'm like constantly doing stuff like that because I feel like it always comes back in a good way to me when I uplift other people in patients' eyes. And it's always bad. No matter how much you think you're doing something good for the patient, when you start dogging on other providers and I can't believe they did this, it just is a bad feeling that is generated. And also a patient, maybe you'll gain one patient and they'll be like, oh, yeah, that was wrong. Well, I want you to do this, doctor. But everyone sees what you're doing at some point, and it's just not good. So let's be positive, folks.
Rising water lifts all boats. And one of the blessings for me as a state board regulator is by necessity, I have to interact with all different types of stakeholders and just everybody. And if you are stuck on an island by yourself, whether you're in just a private practice and you're all alone, or you just don't get out there and talk to others, you're just not going to grow, and you're not going to grow better together, to Grant's point.
Yeah.
All about learning from each other, growing, doing what's best for our patients, and just dropping. I think you got to get past the pride, the mentality of competition. I think once you lose all that, it just only benefits your practice, your work, your learning, your patients.
Ego.
Yeah.
I was surprised in my MBA how much time during the MBA program we actually spent on things like ego and effectiveness and soft skills. Like back to the point of cool. If you're asking somebody, can I come in and watch you? You come in hot, that's probably not going to work, as opposed to figuring out a nuance of what works well, what's going to roll off your tongue as you talk to someone. That's why we talk a lot and give continuing education CE courses, because so much of patient care is communication. Steph and I both did integrative medicine fellowships for the University of Arizona School of Medicine a couple years back. And they really push things for communication. Good communication is actually good medicine. You're getting a patient on board from a regulatory lens. Oh gosh, how many state board cases do I see that are a result of poor communication? We all have bad outcomes. And if you haven't had a bad outcome, you haven't practiced long enough, because you'll get them. And figuring out, okay, nuance-wise, how do I get out of a bad outcome? And that's where interprofessionally with Steph and myself, Perio OMS, we've bailed each other out of various scenarios. That's really nice to have. I've had Steph do some things with soft tissue and even just suturing where I'm like, can you please help me out here? But also just how you communicate what's going to happen. It's so key.
Yeah.
Do you have any comment about that, Steph? You look like you're ready to say something.
No. I love what you're talking about with the communication is key, not only with our patients, our referrals, between providers as what our topic is today. And you've bailed me out of a ton of stuff.
Well, not a ton, but
And you're new. I am coming from the perspective of a new doc, and it is great pride for me that as a new doc, I've been able to teach anything to someone who's experienced, who has the experience.
You know, when you first came into practice, you're like, do you not do CBCTs on all dental implants? And at the time I wasn't. And I had a CBCT machine, you know, long time ago. I was the first person kind of in the North Texas area that had one. I was trying to be overly mindful of, I'm not going to be the guy that has the hammer and everything's a nail. And so I kind of underutilized it because I didn't want to overcharge patients. And I really wasn't smart about it. And you came in and you're like, why are we not doing CBCTs on all the implants? I'm like, oh my gosh, that's actually, we should.
And this is just a different training modality. So I'm from a school of, digital guided, dynamic guided navigation, and you need not only DICOMs for that, but you also need STLs. And so introducing intraoral scanners, trying to figure out how to print more stuff, just to try to.
And a lot of that stuff's great, and a lot of that stuff just drives me bonkers. And I'm like, okay, but
don't get me started on
are we a better practice because of that? Are we able to get better patient care because of that?
We are a more complete practice because of it. And what happens is the patient can choose a lot of different options.
Yeah. And
we like to think that we can provide more of those options under one roof in a very highly specialized way.
Yeah. And I
like that.
It's a satisfaction, learning new things and different techniques and improving your skill set. Who doesn't want to do that? If you don't want to do that, turn off the podcast, because
Bob's asked people to turn off this podcast about 5 times. So
Grant,
I do want to learn. Keep the podcast rolling.
So if you, okay, that's a clear and kind, better way of saying keep it going if you want to learn. But some people, I think here's the challenge: when you've been in practice for a while, sometimes you lose that drive to learn. I loved doing my MBA, especially because it was healthcare management and leadership, because I learned a new language. I learned a way. I loved operations management as a course. You have a different language and a different lens at which you see everything. When I did the integrative medicine fellowship, I looked at every single interaction that I do in a very different way.
Yes, and I hear you on that. And speaking of interactions, if you're a resident listening to this, and you're in your final years and you're looking for jobs, and maybe it will be with a corporate structure, maybe it'll be in a private practice. One of the things that you can do is wherever you end up, get to know the more experienced surgeons in the area, whether it is a periodontist or oral surgeon, because what it's going to do, it's going to find someone to cover for you if you're ever out of the office. It's the trick to fall into, and I definitely fell into this, is you're in school for so long and it's painful. And when you finally get out, you're like, okay, freedom. I'm never going to be under someone's thumb again. I'm going to call the shots. I'm finally the expert. Patients are going to flock. Like, I know the world has been waiting for me.
That's literally how she thought.
I need to just get out there, and then the world will see what they've been missing.
And
it's not like that.
It's not like that. It's an expectation management challenge.
Yeah, it really isn't. And you're gonna learn much quicker if you have the more experienced surgeons in the area, even if they're your direct competition, if they help you. And by the way, they do want to help. If you can reach out, Grant, kind of like you were talking to.
I love that you said that. We've done like an extended mission trip work out of the country, and our quote competitors actually cover our practice. And they're like, they've actually made some really nice comments to us to say, we love that you're doing what you're doing. And it is so nice for us to have that level of support. It gives me goosebumps just thinking about that, because, your competitors, we're all in the same game. We're trying to help patients, and it makes our lives easier knowing that they're there. And of course it's reciprocated.
Well said.
Oh, thanks.
Yeah, hopefully we've touched on some important points here. I think, reach across the aisle, be kind when you're doing it, try to learn from each other. One thing too, because I honestly I love shadowing, and like just last week I was shadowing a surgeon who's just a year out of school. But I learned so much from him just seeing him for a couple hours. He's an oral surgeon, but I think that's how I learn, is seeing what people do and kind of getting into it. And anytime anyone asks me, I work with occasionally GPs and orthodontists and endo, and they'll ask me, "Hey, do you mind if I shadow and watch and see what you're doing?" And I'll always, "Oh, totally, man, check it out." Because I know, these people, a lot of them is just to get information and just to see what does Dr. Stuckey do and what can I refer to him. And I think we need to drop the mentality of like, people are stealing our secrets and learning all this stuff. And let's share. I mean, that's the whole goal of this podcast, honestly. I've given every secret I think I have in this podcast because I want people to learn and grow. But let's let people learn from us and keep constantly trying to learn from other people. And I will just say, when I shadow a periodontist, I didn't do that to steal all their secrets and do everything, because I think the oral surgeon, the Renaissance oral surgery man, thinks in his mind, I can do any procedure, right? Like that's what Bob's thinking right now.
Renaissance. I love it. I'm going to call myself that from now on as I enter the patient room. I'm the Renaissance.
I like the Renaissance.
Wow.
But no, right? Like, we think, as an oral surgeon, I think in my mind, there's nothing the periodontist does that I can't do, right?
Yeah.
And I think that's sometimes faulty thinking, that we have to do everything the other person does.
Yeah.
And I think it's good to shadow just to be like, oh my gosh, that is cool. I like how they do crown lengthening. I respect that. I'm not going to do that, but at least I know how they do it, and I'm going to refer for that reason.
You shouldn't do everything.
And Grant, I love what you're saying, because have the confidence that it took you years to do what you're doing, and someone shadowing you one day, it's just not going to be enough for them to start doing exactly what you do to the level that you do it. And so I love that comment.
And what I would say, and I'll put my regulatory hat back on again, there are negative outcomes that are happening from people who are not trained appropriately, who are not taking factors in. I loved a dental implant conference I went to before. It's like, hey, do one miracle at a time. Well, I had this patient, and they were a smoker and a diabetic and cardiovascular disease, and did XYZ all at once, and it didn't work. Oh, that's a surprise. No, it's not a surprise at all. You should have seen it coming. And unfortunately, you learn so much through seeing things fail. Failure is a tremendous teacher. I've learned very little from success, but having that, if truly, if you can put the patient outcome as paramount, figure out the financials, because if there's a disproportionality in finances, then that kind of messes the situation up. But Grant, you've done a lot for our specialty, for the profession, based on a lot of the conversations you're having. Who would have a oral surgeon and a periodontist on the same podcast?
Thanks for having us, Grant.
Yes, thanks for having us. Hopefully you don't feel as though you've been had.
No, this has been awesome.
This is an important conversation. It really is an important conversation.
Yeah.
And we got to keep it going, and we're going to push to try to be better. As soon as you think you've got the world figured out, you're done. Because the world keeps evolving, and things are changing, and what got you here won't get you there.
Boom.
Terrific book, by the way. It's a hard book if you ever want to pull that one up. But I'm interested in being effective and having fun. You got to have fun as well. We like to have fun.
Yes. Your analogy is likened to that of marriage or parenting, Bob. I feel like the person who's been a parent for one day feels like they got it all down, and me, I've been a parent for 16 years, and like every year goes by, I feel like I know less. I'm just like, how do I parent these kids? This is crazy. But no, I think the more experience you have, the more failures you go through, and the more you start being, okay, I can see how I need to learn more about this topic or be more careful in this setting, and all that type of stuff comes with experience.
Yeah. And I think, Grant, we are in a well-being and mental health crisis in the U.S. and in the profession of dentistry. Steph, as I said, is an ADA wellness ambassador. I'm with the ADA on the dental team wellness advisory committee. In Texas here, we actually changed our licensure regulations to get away from have you ever had to get help for mental health or substance use disorder things, because those questions were stigmatizing and prevented people from getting help that they needed. And there's so many important things. And failure, you're going to fail. And if you're listening to this and you're a resident, okay, yeah, you failed a bunch in residency. To Steph's point, you come out, you're going to fail a lot. And you are well served to have mentors, friends, other people who can bail you out.
You're going to want a safety net.
You're going to want a safety net that bails you out clinically. You're going to want a safety net that bails you out mentally as well. I am successful because of my failures. It's made me
like that
so much more successful. And I've had several that certainly could have destroyed me, but they made me better.
Quote, Bob McNeil quote for the day.
There we go. We've had several. There it is. And if you don't want to hear that quote, you know what they should do, Grant? They should turn off the podcast.
Turn it off. No, stop turning it off, people.
Turn off the podcast.
Yeah, exactly. Well, we love what you're doing, man, and it is such
Thanks
a privilege
so much
for us.
having
we
us.
don't get invited many places.
He loves saying that.
Hey.
I do say that. We keep getting invited. We don't get invited back many places, though. That's where Grant's different. We'll get invited once.
Me and my wife are always saying that, like, how come no one ever invites our family over for dinners on Sundays? There's 8 of us. Like, we don't get invited many places.
Yeah,
oh,
exactly.
Wow. Big family.
Yep. Well, thanks for what you're doing. Anything else you need to ask us, or have we filled the...
No, the only question is, will you do another podcast with me someday?
We love what you're doing. What's your answer, Steph?
For what?
Well, he just asked a question. Are we ever going to do a pod?
Oh, yeah. I mean, I thought that was in the ether. Yeah. Of course. Yeah. Yes. Oh, my goodness.
Yes. Okay, good.
Absolutely.
You're doing important things, and, none of us that are content creators know really what's the impact we're making. And if you change one person's life, if you change one
Starfish story
resident's life, is that important? I think we all want to make a difference in this world and just keep doing what you're doing.
Yeah, I mean, to what Grant was saying earlier, I mean, if you think that you're only affecting you, the people you train as well are going to be affected by the choices you make today.
Yeah, I love that. Well, you guys are awesome. Thank you for taking the time this morning to do this, and let's come up with some more content, more topics, and hit it again.
Let's do it.
All right. Have a good day. Thank you, guys.
All right, you too. Thanks, guys. Thanks,
you.
listeners.